You hear me? Great. So good afternoon. I'm George Isham, co-chair of the Roundtable, and I'm going to ask Bobby Milstein to come up and help me do this. A little technology. I was watching, I've been here half of the day and watching the workshop the first half of the day on the webinar, and I noticed that Bobby had some interesting challenges with this question thing, so I've asked him to struggle with it rather than me. So he's struggling back there in the back. But let me, while he's doing that, I am going to do some thank yous first, and before I go to my summary. One, this has been an outstanding day, I think, just an outstanding day from my point of view. And it's, I think, in large part due to the planning committee and the leadership of the individuals on it. You probably don't know that in terms of the workshop itself, it fits into a larger sort of set of questions around what kind of assets and resources can be generated to support an improved population, the vision of the Roundtable, which Sani went over for you earlier this morning. And Bobby Milstein, in particular, has been very helpful in helping us think about those resources and how to perturb the existing flows so that we get a better sort of output for the resources we're putting into the American healthcare system, which are obviously a big problem in terms of value for the amount of money spent. I think that point also made earlier in the day. So a particular thank you to Bobby and the conversations we've had at the Roundtable for framing up this idea and then handing the issue over to an excellent planning committee, which I think has done a really good job on this on the workshop today. And they are Ella Auchincloss, Kathy Gerwig, Alan Gilbert, Jeremy Greer, Jim Hester, Giridhar Malya, and Bobby are the planning committee. So let's thank them. With that thank you in hand, you can now struggle in public once again.
The struggles are over. We've had a terrific day, and we were trying to do a little pre-post thing on confidence. So this is the post. So you can imagine where you were this morning. You know, what sort of vocabulary did you know about taxes, tax incentives, regressivity, progressivity, expenditures, uses, co-benefits? These are just a few of the words that come to mind for me. My hunch is that this is a bit of a departure for all of us. I think the phrase that I heard most often was, "I'm not a tax expert." Flash, nobody really is, and Pete's gone. I bet he didn't know half the things that came out in this afternoon here. So keep this vote going, and we will continue with more qualitative reflections over the day.
Word cloud? Word cloud is... Okay, all right. So a couple of observations. Let me make a couple of observations while those little bars are jumping around. You can jump in any time and say anything you want about this, Bobby, since I'm not going to touch it. So first of all, this is the very point that is now being made by this, is that we started out by labeling ourselves not as experts, and hopefully this is saying that we've made some progress over the coming day, although I'm not quite sure what the heck it's saying, Bobby. But I suspect that we have explored the topic in a very productive kind of way, and at least we feel a little bit more confident about how tax policy can play a role in population health planning. I know that's how I feel, having self-identified with the non-experts in the room. And I thought the very other sort of thing is that we started as a country with tax dispute, and here we are today. I mean, and we're not finished with that. I thought the comment earlier by Giridhar, I hope I'm saying his name correctly, Malya, about taxes are about values, I think is very, very important. And I'm not so sure a lot of our conversation over the course of the day has made that really explicit. But if you've got winners and losers, and if it's about the influencing behaviors, then it seems to me that it's you've got to be pretty clear about what your values are and what you're trying to achieve, and who your allies are in trying to achieve that. If you're going to be an actor in this policy, a lot of our conversations over the course of the day have started with, I think, unstated assumptions, and I think that it's probably useful to be, at least when you're a strategist trying to think about what you're trying to achieve, is make sure you're explicit about those assumptions in terms of what you're trying to achieve in tax policy. So for example, with the table we had on the opioids, I'm not so sure that a lot of pharma folks would have agreed with our logic and thinking about developing that tax. And I was sort of asking myself as we went around the tables, what are the unstated assumptions, or what are the shared assumptions and the unstated values that we have? Secondly, it occurs to me that there are larger meta issues that kind of might have come forward over the course of the day. Just the meta issue I think of is the role of government itself versus the private sector. And where do you stand in that? And therefore, how do you kind of layer out in terms of your acting? And I think it's good to be aware of those kinds of contextual kinds of issues. We're not surprised that establishing a new tax is hard. It was hard for us. Just think about it. I mean, that was very, very useful over the course of the afternoon to begin with the examples and the exercises. So very, very, very important to give us a feel for how hard and difficult it is to think these things through and to think about the unintended consequence and how many people you really need to engage in order to really know that. So I know a little bit more about insurance policy than a lot of people do. And I could see in the insurance example around self-funding, for example, how that particular example could skew the benefit to the upper levels of the insured population. And so I think we've really got to think of, when we're thinking tax policy, how you go. And I think about that comment that Pete Davis made early on, that some of the best kinds of input that he had were from the lobbyists, who really are acutely thinking about how this can be gamed, how that can be made, and you want to listen to them very carefully, and then incorporate that into your planning if you want to achieve objective. Because no one of us in this complex kind of endeavor of thinking about health policy or tax policy is expert enough to know all of the potential ramifications and gaming that can occur. So those of us who want to be strategies to use tax policy to improve population health, we've got to roll up our sleeves and be prepared to really dig into it and really listen carefully as well as have good ideas. So that's another takeaway I had from it. Tax the sins, and I added in my notes as I was listening to the webinar, credit the virtuous behaviors. I heard from early in the day. The externalities lead us to make exceptions. I thought that discussion was very illuminating for me anyway. I hadn't really thought about that too hard, and I thought that was a very, very important part of that early discussion. With respect to the local taxes, just the scope of local taxes in terms of states and locals collect about a third of the tax and a quarter of the domestic spending. Wow. And the state tax is regressive. The whole regressive discussion sort of is an interesting, very interesting and important concept about what those words mean to you and how you value them and what they really mean in terms of your objectives of trying to achieve them. And so I think there's some work to be done in terms of thinking more carefully about that. And then corporate taxes, we just mentioned it, but we didn't get into it. And I'm still wondering about it. You know, since that's such a big feature of the current tax policy, but we didn't really talk about that role and that cascade of where things are taxed in that cascade and how that might be useful for us to think about it in terms of population health policies. That may be a follow-up that we might want to think about. I heard mention of Minnesota's tax law. I'm a Minnesotan, or used to be, and I guess I had the questions of, well, why? is that Minnesota tax law good? How did it get established? And what is it exactly we're talking about, and who's responsible for it? I think there's an opportunity to dig a little deeper there. If that's a good example, and I'm taking that comment and saying whoever made that has the ability to assess that, well, let's dig into it and find out why, how, who, and the specifics and what kind of example that could be. The sin taxes need a new name. I hadn't thought about that. I love the word sin taxes, but I think that point was a very good one. Well, what name should it be? Then I think then we get to the examples in the afternoon, and I again thought that the exercise and the experience of going through that was very, very, very helpful. So Alan made some good comments, and so did Ann in terms of giving us examples. And I think that's his conclusion that there are a lot of good examples out there, and we ought to pay attention to them, I think is the right one to make. So those are some of my observations from the day. I think it's a very important way of thinking about assets and resources and funds flows. And I think this is a critical kind of tool in the kit toward really building an infrastructure to change the trajectory of health in the country. And I thank the Planning Committee and Bobby for that, and all the presenters. Thank you all for doing that. We have now a bit of time for your reflections. What have you learned today? This will be a more useful summary if you come and make some observations about the day's conversation. I understand from Alina that we have a very hard stop at 4:30 because of the room here. And so when we get to 4:30, whoever's talking, I'm going to cut you off. I'm not eager than people being offended. And you might want to consider, you know, how long a comment you want to make and how detailed a comment. So comments, and is Kamani, you've got a microphone. Okay, he's going to be moving that around. I'll take some comments from the group in terms of summary comments, reflections about the day, what it means, the value of this, what we should be doing. He's got it. Back to Tom, you're going to, I'm going to go with,
okay.
And then you're going to be next, Tom. All right.
So I, like everyone else, definitely came here not knowing very much about this, though certainly understanding that the flow of resources makes a huge difference. I just want to make a general comment, and that is how incredibly valuable it has been to me, not just for this roundtable, but some of the other roundtables, in exposing me to tools and disciplines that I knew really nothing about, and how this kind of cross-sector dialogue is so incredibly important to achieving our goal. I think, you know, as you think about population health, you know, what's the difference between public health and population health? People think population health is done by people who are concerned only about public health. But I think the kind of workshops this is an example of really makes the point that this has to be a cross-sector collaboration, and that no one sector knows nearly enough to move the population health forward.
Excellent. Tom?
Yeah, George, thank you. And I particularly appreciated the case studies, because it moves it out of the theoretical and says it can be done, and it also gives people hope. I'm very confused about the Minnesota tax law, because my understanding, I could be corrected, is that per capita funding of the public health by the state in Minnesota is very near to the bottom of all the states, and most of our public health comes from grants from the CDC.
Well, I think that's why I asked my questions, Tom, because I think that comment was made, and I took that comment as the person that made it had a fund of knowledge about comparative tax policy among the states. And I think we need to dig in and find out why that's been said. It may have nothing to do with your observation, or it may have something to do with that observation. I don't know. Maybe that's a weak part. But certainly understanding good examples of tax policy and very specific kinds of things. For us who are generalists and novices, will give us a fund of knowledge about what to advocate for and what to be supportive of, rather than leaving it to those few people that really, know the details of it. And I think that's important for a broader constituency to have that sort of thing. So that was the nature of the point. Now, you may also be making another point about the level of funding of public health in Minnesota, which may also be important, but I don't know if they're linked. So let me just say that. Other comments?
Okay.
Yep, go ahead, Terry.
So thank you. I think for me, the Berkeley example is very instructive because they got into some of the strategy components that helped you think about why they were successful in their mind. And the engagement piece, particularly as it related to the regressiveness, I think that was very helpful to think about. I also think that it's as important to understand, and I think that Javier referenced Cook County, where they had a rollback to understand those circumstances, and what are the important components to assure that you have some that these things have a life after the initial vote. So those pieces, from a strategy standpoint, I think learned enough about tax policy to know that if we're going to work on something, we're going to go get somebody who's an expert in tax policy, which I think is important to understand in terms of trying to scope the work. So I thought it was a great conversation.
Great, thank you. Jeff?
Day, but I'm struck by two things, I guess. One is, I guess it's really one thing, that there are two types of taxing that we're talking about, really. One is taxing that will change behavior, and that's the target excise taxes, whatever you want to call them, whatever the new term is for sin taxes. And that has a direct health outcome. And so we're using the tax system to achieve a health outcome to change behavior. Then everything else we talked about was really how do we find revenue for population health improvement. And maybe this is because I'm intellectually lazy about taxes. The case that we have to make for a tax policy versus general revenues, or whatever it may be, is very, very similar. I think the difference is that perhaps using tax policy, we can try to find money, to get money out of people who might benefit from this population health improvement in a targeted way. But we still have to be able to make that broader case that the population health improvement will matter. Now, the fact that we're playing with all these tax ideas is because those are the cards we've been dealt, and those are the tools that we have available to us. But I think we have to think long and hard about whether we're building one complexity over another. I mean, Anne's excellent presentation about how complicated this is to braid and blend all these things. And now we're saying, okay, now go use 5 different tax tools in addition to the other things that you're braiding and blending. And we're adding whole layers of complexity and asking people to take on something that is substantively very complex as well, which is population health improvement. So I wonder whether we maybe just be getting too clever for our own good.
Yeah, that's a very good point, in my opinion. If I can make an additional comment, I thought when I looked at Pete Davis's little thing that he sent around, that primer, whatever you would call it, I think everybody got that. I'm sure everybody did. I thought that was, very simple and in one way, but also very well done in terms of laying out the policy, laying out the principles, the aspects of it, and some of his observations. And then I thought he did a fairly good job when he was talking about illustrating that with programs. But what I thought was kind of missing was sort of what does it take to evaluate a tax proposal from the perspective of population health improvement? And so taking those sorts of principles and rewriting them, Jeff, in a way that gives you and me, who think about other things in a different kind of way, sort of a guide of questions that we ought to be asking about, that forces me, and I won't say you, but me, to really think a little bit more about that detail. so that we can be a little bit more informed or a little bit more responsive, or put our support, if we have support to give on behalf of an institution or an organization, in a different kind of way, would be useful. And so if I could add another little thing that might be a follow-up to this, it would be to ask him to modify his approach, or add to it sort of a, how do you evaluate a proposal? Go ahead.
Okay. Something came from the web, actually. It was on Twitter. Caroline Fichtenberg, whom many of you know, tweeted, if income is a fundamental determinant of health, why not focus more on progressive tax policy as opposed to tax policy to fund public health efforts? And she was actually echoing something that we heard earlier from Linda Rudolph as well, who said, what about just investing in more EITC or spending more attention on that?
Or the universal.
Right.
Or exact universal basic income, that's right. And then the other thing is, I noticed that Nick, who's still with us, tweeted about the Minnesota tax, so I wondered if you wanted to say something about it.
Let's give Nick a microphone.
Thanks, everybody. I have to say, as a sorry, as a tax policy person sitting in with a bunch of population health experts, I am absolutely convinced that tax policy is way simpler than population health. I mean, it's really not rocket science. You all figured it out pretty much in a day. You know enough to be dangerous. But just from the bits, even though that wasn't the topic today, from the bits and pieces that were being discussed, you know, I did put on Twitter a link to some a piece which links to other pieces about, if you really want to dig into the details of what Minnesota did back in 2013. And it is, you know, to Ella's point, as much a story about how you move policy as the details of the policy are interesting. The really interesting story is the coalitions that came together. They drove the election of a new governor and a new legislature. A lot, you know, funders played a huge role in having the institutions on the ground to build the campaign to inform the candidates in an entirely appropriate C3 way that, or C4 way in some cases, that then put in place a pretty good tax policy. But the other key lesson, of course, is it's not perfect. Like, it doesn't necessarily surprise me at all that Minnesota ranks near the bottom on population health. Almost every state ranks at the bottom on something. And so
It's public health funding,
public health,
which is different than population
okay,
health.
sorry, public health funding. My point only is that, you know, people say, tell me what state has the perfect tax system? What state has the best? Like, no state has a perfect tax system. They're all idiosyncratic. They're all, tax policy always is about, you know, making changes around the edges to get a little closer to better, but rarely does anyone get anywhere near perfect. So all that to say is, you know, I appreciate the opportunity to be here, and but do learn a little more about the Minnesota story, because it is pretty great.
Thank you for adding to the conversation and our dialogue.
Back here, just sorry, wanted to respond to the question about Berkeley. I'm Lizzie Belton from the American Heart Association. I'm the government relations director for the Greater Bay Area. So have known Javier Morales for quite a while now and worked on the ground in Berkeley, Oakland, San Francisco, continue to work in those places. And I did want to echo his point about how the strength and the diversity of the coalition was really key. And that continues to be the case. So I was just down the street at Oakland City Hall with a large group of the same people who helped to get votes for the Oakland soda tax to throw fire at the mayor when she decided in her budget to take what is a general fund tax and use it for whatever she wanted to in her budget plan, which was not upholding the promises that were made in the campaign to spend it on population health program. So the coalition came to the city council. First of all, the champions on the city council, to the point about champions, the champions on the city council found out way before the public what was going to be in the budget from the mayor, and alerted the coalition and the members who had fought so hard for it on the ground and made promises, including doctors and pediatricians and clinics and, you know, to their patients, please vote for this. This will help you. This will improve your health. Came and it was not a pretty scene when she presented this budget, because we were all there to tell her, no, you will set aside this funds for what the advisory committee, based a residential advisory committee will advise you. The community wants those dollars to be spent on. So tremendously echoing Javier's point. Also to the point about where soda taxes have not been successful in other places. There's a big difference between California requirement for it to be a ballot initiative. You have to do the voter education, you get the voters on board, and you have a majority of them to vote for it. That's how you get it, versus a place that does it through a city council, through their elected officials who pass it. Whether or not there's trust in the city officials that they're going to spend it on it is a problem in both cases, actually. But it requires much less of the coalition work, and it has failed in some places. It's not failed in other places. So I don't think that it's universally not the way to go, but I do think that you need to build it from the grassroots up, the support of the people, and they have to believe that you're going to spend it on something that they care about, whether that's Philadelphia and early education. That can happen, but it didn't translate to a ballot initiative in Santa Fe. So go on and on about the details of the policies, but it's not just about designing them, it's about how you pass them, and then how you follow them through and make sure that they're spent in the way that people believe in and work for the people.
Appreciate that point. Other comments on reflections on the day? Not to carry on that conversation because we have little time, but go ahead.
I'm going to go.
You're going to go, and then I'm going to go right to you, okay?
Okay, so I've learned a lot. I learned about how I don't know enough about taxes, but I would love to see a part 2 that gets at some of this macro stuff on the role of government in our society, that gets at this broader narrative we have of scarcity versus abundance, and how there's never enough. We can't afford it. We can't afford health. And how do we move away from that? Because the reality is, whether or not we can afford it, we should be doing it. And how do we talk about these bigger sort of narratives that we have in our society that are sort of preventing us from making some really solid tax policy decisions? And how do we do that knowing that we also have to do the sort of the short-term stuff and get folks the things that they need, and have sort of that short-term, whether it be earned income tax credit or something, and a longer term vision for where we want to go in terms of how our collective resources are spent as a society. So I would love to see a part 2 that talks a little bit more about that stuff.
Thank you about making the larger narrative point, which I think is also important. Go ahead.
And so first, thanks again to everyone for putting this day together. I too have learned quite a bit. And in the spirit of a part 2, and also your comment, George, about different values. I've been thinking a lot about different definitions of fairness in our own society and how that gets implemented in the tax code or not implemented in the tax code. And so I feel like today we've had, our toolbox, even though we've expanded it some, is still constrained. And so maybe in the part 2, we could look to other countries that have very different values than we do, and operationalize those values in very different kinds of tax structures that, from an evaluation perspective, yield much better population health outcomes than we have.
That's a good point as well. Right back there.
So 2 quick equity points, since health equity is one of our principles for today. The first, back to EITC. So not only does it address sort of a fundamental cause of health disparities, it gives money back to low-income people and says spend it on things that you see have value. And people end up paying off debt, including medical debt. They repair their car so they can get to work. They invest in their kids' education. So I think that's a way to really ensure that the resources through that tax credit are used equitably. The second is that we've talked a little bit about racial equity over the course of the day, but it hasn't been sort of a big part of the conversation. We've mentioned the regressivity of mortgage interest deduction, and that basically renters, low-income renters, cross-subsidize that mortgage interest deduction for higher-income folks. There's a whole racial lens that needs to be applied to that as well, because when the Federal Housing Administration and the VA backed mortgages in the middle of the 20th century, African Americans were explicitly excluded from that. Mm-hmm. And these issues play out intergenerationally. We may not want to bring that up in sort of political circles and political debates, but it's critically important for the work that we do.
Thank you for those comments. I was thinking, actually, it reminds me of a thought that I had earlier in the day while I was watching the webinar, and that part of the conversation that touched on just what you were saying. I was wondering what the relationship was to the Roundtable's previous conversations on structural racism and those factors that create it, and the relationship of those kind of factors to fix in place disadvantage or advantage, depending upon how you look at it. So, very good point. Sani, I think you wanted to make a point. Martha, and then Sani's next, and then whoever else beyond that. I see Mary Pitman with a microphone. Go ahead.
So great day. Thank you for the organizers. I was sort of thinking about this in terms of a kind of a meta view of the Roundtable's work in the context of what's going on federally in terms of tax reform. And also thinking about Machiavelli and behavioral economists who together believe that losers care more about loser than winners care about winning, and yet we have a tax bill that's going through that seems to create an enormous number of losers who seem, as the American public, not to support the tax bill. And so I guess going back to some of the things we've thought about as the round table, you know, we need to get people out to vote. We need to get people organized. None of this is going to change any meaningful way unless we can change the sort of power structure of who is making decisions in the country about how resources are expended.
Good point. Sani, we're at 426, and then Mary Pitman.
I thought the discussion about cap and trade, and I talked to them afterwards, that it really had a bipartisan appeal. But now it actually was very effective in accomplishing lowering pollution. But now the topic of climate change does not allow the bipartisan appeal. But where would we find bipartisan appeal, and where is the common ground? And what if today we'd actually brought in people with opposing views and tried to do the exercise and tried to listen to another side, and what does that look like, and how do we begin to foster that common ground for trying to move to effective tax policy? I really like the quote, "All roads lead to tax and policy changes," that Christopher and Nick had to say. Yeah. And then the last thing I just want to observe is a lot of times it came up in our exercise that legalizing marijuana and taxing it was a policy piece. I think we should just add a note of caution to the public comments that we don't know the unintended consequences of doing that. And there's new evidence coming out about that, including the effects on children. So I think we should just make that as a star, since we're so evidence-based, that we really don't know the unintended consequences of that.
Okay. Mary Pitman.
I go back to Pete's conversation with us early in the morning, and there was one thing that I had to keep going back and thinking about, and that was the issue of transparency. And I think it may be more expedient to do tax policy behind closed doors with a lot of experts, but it certainly is not the framework that I would like to see us advancing, because I think the messiness and the issues about equity, about race and who's harmed, a lot of the questions we went through today may not be brought up by tax experts, but they would certainly be brought up by community members and people who might be the losers, who would have an opportunity to know what they're losing, versus I think right now there may be a lot of losers in some of the proposals that are out there, but they don't even know it yet. Mm-hmm. So to me, one of my takeaways is kind of reinforcing my thinking about the need for transparency, particularly around tax policies. And I think we've laid out in our exercise today a framework and some good questions for us to be asking when we take a look at some of these policies.
I think that's a good statement too. I think we're going to need to conclude at this point. I think Pete talked about the sewer of campaigning. That was a quote that I wrote down. Campaign financing, right? Well, campaigning too. Yeah. But I wonder about this fairness, equity kind of thing, whether individuals in our country are multiplied by the degree of financial influence they have with politicians, to create the mathematics of it, as opposed to the number of individuals, to your point, Martha. And I think we need to think about that. And I wonder when we need to be looking at the principles of fairness and equity and transparency with respect to the people we're serving and the communities we're working with, and when it becomes a strategy to prevail in terms of pushing a policy forward on behalf of those, and what kind of behaviors you need to follow to do that. And I don't know the answer to my own question, but I just think there's probably more sophistication to how you apply those principles rather than at what phase of the process than we might think about. So anyway, this has been a terrific day. A couple thank yous I didn't make are to the excellent staff that we've had assist us. Kamani Hamilton Ray has done a nice job. Carla Alvarado has done a great job. Thank you. Alina Bachu. And I must say, we don't have the opportunity to directly thank Rose Martinez very much for an active role in our and I think we should do that. Thank you very much, Rose, for stepping up. This has been a good day, and I hope you've learned as much as I have from it. We stand adjourned. Thank you.